Welcome to This Week in Dermatology. This week, we're covering 10 notable papers spanning systemic therapeutics for inflammatory skin disease, diagnostic imaging innovations, and pediatric and supportive care. Let's dive in. We begin with major advances in systemic therapies for inflammatory conditions and cutaneous oncology. In hidradenitis suppurativa, therapeutic options continue to expand, yet substantial unmet needs remain. Porter and colleagues evaluated the efficacy and safety of Povorcitinib, an oral, highly selective Janus kinase 1 inhibitor, in patients with moderate to severe hidradenitis suppurativa across two identically designed, randomized, double-blind, placebo-controlled phase 3 trials, known as STOP-HS1 and STOP-HS2. Adults with moderate to severe disease were randomized to once-daily treatment through week 54 with Povorcitinib at 45 mg or 75 mg, or placebo with crossover at week 12 to active treatment. The trials demonstrated that both doses met the primary endpoint of a 50% or greater decrease in total abscess and inflammatory nodule count without an increase in abscess or draining tunnel count at week 12. Specifically in STOP-HS1, roughly 40% of patients in both Povorcitinib arms achieved this benchmark compared to 30% in the placebo group. STOP-HS2 showed comparable superiority, with roughly 42% achieving the primary endpoint across active arms versus 29% on placebo. Through week 12, serious adverse events were low across all groups, occurring in 1 to 2% of patients receiving Povorcitinib and 2 to 3% on placebo, with acne, nasopharyngitis, and upper respiratory tract infections reported as the most frequent adverse events. Oral Povorcitinib thus provides significant clinical improvements with a manageable safety profile in this challenging patient population. Turning to cutaneous lymphoma, Ingenhouse Oro and colleagues published work in the British Journal of Dermatology examining durable remission and survival outcomes following the discontinuation of mogamulizumab in Sézary syndrome, offering crucial guidance for long-term management strategies. In diagnostic dermatology and procedural triage, advanced imaging continues to refine how clinicians handle equivocal lesions in cosmetically sensitive areas. Guida and colleagues conducted a prospective multicenter study, 0.006 flat pigmented head and neck macules from 801 patients, to assess the impact of integrating reflectance confocal microscopy into dermoscopic triage. Suspicious or discordant lesions underwent biopsy or excision, while double-negative lesions were followed for at least 1 year, with histopathology serving as the reference standard. Following dermoscopy and reflectance confocal microscopy integration, nearly 12% of lesions were managed as malignant, with histology ultimately confirming 114 malignancies, including lentigo maligna, melanoma, and basal cell or squamous cell carcinomas. While dermoscopy alone detected roughly 55% of lentigo maligna and lentigo maligna melanoma cases, reflectance confocal microscopy correctly diagnosed over 91% of these melanocytic malignancies and over 94% of keratinocyte carcinomas. As reported in the Journal of the American Academy of Dermatology, integrating reflectance confocal microscopy significantly improves sensitivity for detecting lentigo maligna while boosting specificity for benign lesions, thereby minimizing both over-treatment and misdiagnoses in delicate anatomical zones. Also addressing diagnostic and triage challenges, Chiruma Milla and portfolio colleagues evaluated causative medication assignment in drug reaction with eosinophilia and systemic symptoms in the Journal of the American Academy of Dermatology, highlighting a high level of uncertainty in culprit drug identification. Meanwhile, Pietkowitz and co-investigators explored magnified ultraviolet-induced fluorescence dermatoscopy for assessing mite viability in scabies within the Journal of the American Academy of Dermatology, and Markoval and colleagues reported on a single-institution case series of cutaneous leishmaniasis in patients receiving anti-tumor necrosis factor alpha therapies in clinical and experimental dermatology. In pediatric dermatology, caregiver-reported outcomes and vascular anomaly management received important attention. Fang and colleagues established the initial psychometric validation of the Caregiver Atopic Dermatitis Control Tool. Building upon the validated atopic dermatitis control tool used in clinical trials for adolescents and adults, The new caregiver-reported instrument was developed using Food and Drug Administration recommended methodology for parents of children aged 6 months to 11 years. Evaluating the first 100 recruited caregivers, the authors demonstrated strong internal consistency, robust construct validity, and strong inter-item correlations, identifying a score of 7 or higher as the optimal threshold to designate a child's eczema as not in control. Complementing the supportive care data, Faison and colleagues published a comprehensive review in Pediatric Dermatology detailing the evolving systemic medical treatment landscape for vascular malformations. Reviewing classifications from the International Society for the Study of Vascular Anomalies, the authors highlight how modern pharmacological advances, including systemic and topical beta blockers, as well as newer targeted agents, have successfully decreased the need for invasive surgery while improving overall quality of life. Additional studies published in the Journal of the American Academy of Dermatology included a network meta-analysis by Zhu and colleagues on rosacea interventions across phenotype-relevant outcomes, and a retrospective review by Adediji and Agu investigating whether insulin resistance predicts response to low-dose oral metformin therapy in patients with central centrifugal cicatricial alopecia. If you only have time for one paper this week, make it the Phase 3 trials of Povorcitinib for hidradenitis suppurativa. These robust, identically designed trials provide high-level evidence that oral JAK1 inhibition effectively targets moderate to severe disease, offering clinicians a powerful new systemic option backed by clear efficacy numbers and a well-characterized safety profile. Here are the key takeaways from this week in dermatology. Oral Povorcitinib significantly improves clinical response rates at week 12 in moderate to severe hidradenitis suppurativa with a manageable adverse event profile. Integrating reflectance confocal microscopy into dermoscopic triage for flat pigmented head and neck macules substantially enhances the detection of lentigo maligna while reducing unnecessary biopsies. The newly validated Caregiver Atopic Dermatitis Control Tool provides a reliable Food and Drug Administration aligned instrument for assessing eczema control in young children, with a score of 7 or greater indicating uncontrolled disease. Finally, medical management of vascular malformations continues to expand, offering non-surgical alternatives that improve patient quality of life. That's your roundup for this week in dermatology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.